This week on Act Out, a special episode that looks at a grotesque statistic and asks the question, if you can judge a government by how they treat their most vulnerable and marginalized, how much more pointed is that judgment when you look at the hometown of that government? DC and the practice of condemning predominantly black mothers to death. From tweets to marching in the streets, this is Act Out.
Rockets! Blockade! Bulldozers swarm outside the checkpoint gate. An orange flash broke the hush and blew me into the street. I awoke next to the body of my baby. No!
Welcome to Act Out. I'm Eleanor Goldfield, and this is your tipping point. In this week's special episode, we're taking a look at the capital of the empire. A quote often attributed to Gandhi, but that's actually part of a speech delivered by former Vice President Hubert Humphrey in 1977, right here in DC, goes like this. The moral test of a government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, those who are in the shadows of life, the sick, the needy, and the handicapped. Now, a great many and beautiful things have been said in speeches, whereas the reality gets lost in translation. Still, it's a valid statement. And if you can judge a government's moral compass by how they treat the most marginalized and at risk, what can we say about that same government's actions in its own hometown? DC's maternal mortality rate is not only higher than any state's, it's also over twice as high as the national average. Side note, our lack of access to basic democratic rights due to no statehood is another issue, one that we've covered on the show. But even so, these numbers are alarming and totally unacceptable. And they are due to lack of accessible care for those who need it the most. In this so-called maternity desert, black women made up 75% of maternal deaths in DC between 2014 and 2016. At the same time, DC has the highest infant mortality rate of 25 rich world capitals. The idea of mother, child, or both dying in childbirth in 2020 seems absolutely absurd. And it totally is. However, when you look at how this system is set up, this is the only sensible outcome. If you destroy communities, suck out money, resources, and access, don't act surprised when people suffer and, in fact, die. Here to talk more about this atrocious and totally avoidable situation are representatives from the DC Nurses Association, as well as an organizer with 1199 SEIU, United Healthcare Workers East. Take a look.
The biggest concern for DC Nurses Association, we have seen a systematic process to close down access to healthcare east of the river. From the time that I've come here and throughout DCNA, at one point, United Medical Center was a robust hospital. They also had DC General. They had hospitals closer, and there were many hospitals that closed over time. And now, since I've been involved and we've been representing the nurses at United Medical Center, we have seen a consistent gutting of the hospital, cutting funding here and there, closing down the OBGYN unit when that's a unit that's needed, just not putting in any more money to any services. Any of the questioning of the actual officials is not about what services can we put in the hospital to make sure that people have what they need. It's more about how many people came to the hospital in this quarter. So this is not about really increasing the services, increasing the needs, meeting the needs of the community. Instead, it's all about a dollar. And what you will see now is that they have legislations implemented that if the board has to use more than the money that's allocated for them, which is very small, we only got it to 22 million because we advocated. Understand that it was initially 40 million by the mayor to put into the hospital. It was the Committee on Health that cut it down to 15. It was the advocacy of our organization in coalition with 1199, DC Jobs for Justice, and a lot of other organizations came together to get it to 22 million only for 1 year. So we're saying that going forward, we're going to go back to 15 million for subsidy for a hospital that's running completely on Medicaid funding, nothing else. Medicaid and Medicare, most of the people at the hospital do not have private insurance. So now you're making sure that the hospital closes. So if it goes over that, then they're going to implement a control board that would essentially say no. So where is the discussion of true healthcare? And then when we come to the new hospital, they're going to put a new hospital in, not ensuring that the workers who provided care for the community for years are in that hospital. And additionally, they're calling it a community hospital. They're not giving full definition of what type of trauma services will be there, what type of services will be there. So even if they're going to bring something else to provide care to those east of the river, why is it not defined when you have 4 hospitals, full-fledged hospitals on the other side of the district?
They cut OB services at the hospital, United Medical Center, where we represent about 450 plus members. And there hasn't been obstetrics unit there for almost a year now. And so when women, present to the hospital, a lot of times they're high risk, women who have not had much or any type of care, prenatal care, and they're showing up at risk at the hospital where they're forced to deliver in an emergency room without an OBGYN specific doctor or doctors there on site to care for them.
I worked at United Medical Center, Greater Southeast, for 37 years on the third floor, which housed the mother baby unit, OB, labor and delivery, women's health care on one side of the area, and then the other side we did med surge opposite that area. We saw the systematic shutdown of labor and delivery, nursery, and all of that when we initially lost our accreditation, and that was lost because of funding, still inappropriate amounts of money. Services that were routinely offered there were no longer offered there. So when we initially lost our accreditation, it was also due to going into bankruptcy because money was misappropriated by the people that were in charge, which they never were taken to task for it. It was just money that was gone. And then they started bringing in outside consultants, heads to run the hospital that had no investment in the community, did not understand the community that they're coming into, that the needs of the community. They systematically tell you that diabetes is running rampant, hypertension is running rampant, HIV is on the rise again, fetal deaths, maternal deaths are on the rise again, but then they systematically take the money away for the services. You can't bring it under control again without having the services in the community. As we have progressed, and even up to now, it's getting systematically worse because when they cut the amounts of money that they're budgeted for running the hospital, then we don't have the staff. The first place they start out is cutting the staff. They cut services. You're telling me, and you were in a area, Ward 7 and 8, that has the hypertension, diabetes, HIV, all of these things, but yet still, when you get to the hospital, the services are not there for the people that need them. The MRI machine is down, the CT scan machine is down. So when they do come in and they're seeing, they have to go all across the city to get services that they need and then to follow up. Well, 9 or 10 times they're not going to do that, especially if they live right there in Ward 8 within walking distance from the hospital. You can give them a referral, but are they going to follow up? And then it used to be a time there would have been someone to call to follow up with them. That it's not available because you're cutting the staff so tight that they don't have extra time to call and say, Ms. Jones, did you make that appointment? We need you to get the scan done in order for us to move forward with your treatment. So all of these things were systematically done.
A little under a year ago, there was another hospital that was in the general vicinity of where United Medical Center is now, Providence Hospital, which was a private hospital and decided to close. And so that was where a lot of the deliveries were being done. And so it was, taking the pressure off and easing the situation for, mothers east of the river. And since it's closed, they've also closed the obstetrics at United Medical Center. So now there's literally nowhere east east of the Anacostia River for women to present and, whatever shape they're in, make sure that they're going to have the best possible opportunity to deliver a healthy baby and, survive that process themselves. And so it doesn't make sense to me why that seems to be the case. And right now, all we've seen and heard is lip service to the fact that that will be remedied, except we know through conversations that we'd had with the city administrator's office, there is no plan to put a high risk obstetrics unit in the new facility, which means while they're saying they want to do something about it, that's something they could very easily do. That wouldn't cost that much, even if that was prohibitive, which it shouldn't be. That's not something that they're willing to do.
We started hearing this about 2016. There were statements made by some officials at United Medical Center that the OB unit was not cost effective. And we started hearing that before, maybe even a little before then. At that point, we actually asked question as to what they were doing to even put themselves out there in the community about the fact that the hospital is open for OB services and a lot of prenatal care, things like that, that the hospital could do so that there wasn't high risk pregnancies, which many of the nurses brought to my attention, most of the pregnancies in the OB unit were high risk. Even, we're not talking about older women having kids, we're talking younger and still having all these problems. But when we question about it, then they pull back and say, oh, we didn't say that, we're not saying that. So when Department of Health came in and made all these suggested changes that should be done, we felt that if the hospital truly cared about what was going on around in the community and the fact that there was a lack of an OB unit because Providence closed, DC General closed. So we're looking at DC General closed in the early 2000s. Providence was already closing. They were having hearings about the closure of Providence. So you've got all of the Southeast area and even closer to Northeast with not much services only but Washington Hospital and going even further uptown. So we actually talked to them about that they needed to work on trying to make sure that this unit stayed, that they made these changes quickly so the unit can open back up. So then all of a sudden in a closed door meeting, which was a violation of the Open Meetings Act, they decided to close the OB unit instead of making the changes. Now, if you go to them officially on record, they'll say, well, it was closed by Department of Health. But the board is the one that decided not to do anything to ensure that it opens back up to make the changes. Now, they're not even going to give us really details about what the actual changes that Department of Health. Now, we requested through a FOIA request the letter to the hospital about some of the concerns of the OB, but what the recommendations of working with the Department of Health they did not do. Not to mention that that most of the board members are either appointed by the mayor and approved by the Committee on Health, the council. When we went to the council, well, they're saying, well, everybody's blaming everybody else. Like, oh, it's not us, it's Department of Health. Oh, it's not us. Gray would say, well, the board closed the OB unit. And then you talk to the mayor will say, well, the mayor's folks will say, well, the board is the one that voted in. Then you go to the board and they would say, well, Department of Health closed us. So the fact that we were very suspicious because on and on we started to say, okay, is this really about Department of Health or is it just that now you have an option to close it and you decided to do it because your whole argument a couple years before the findings at DOH is that it was not cost effective.
So 1199 SEIU, United Healthcare Workers East, represents about 450 members at United Medical Center, which is one of the hospitals, in fact, the only acute care hospital in Southeast DC. And so, while our members work at the hospital in various different roles, they also live in the community. And so they also are patrons of the hospital. Their families, their grandparents and parents and their children all attend this hospital because it is the closest hospital to them. And so not only are they talking about the community that they've been serving, some of them for over 40 years, they're talking about their friends and neighbors who are not seeing, the same access to quality care that they deserve. And so that's a real problem for them just because of the fear of not being able to get what you need when you need it. Someone could have an asthma attack. And while asthma is not something that's, life-threatening on an everyday basis, there are ways to sort of, manage that. If you are in a crisis where you don't have an inhaler, you don't have the tools you need, And you got to go to a hospital and they don't have what's needed at that hospital because of the cuts to services or because of the lack of staff that are there because of layoffs. That's a real problem for you. And to be able to travel all the way across town to another hospital is not an option. You'll be dead before you get there. So this is what they're dealing with. On top of that, you layer on that once this new facility is up and running, because of who the potential new manager of that hospital will be, they're likely going to be out of a job. Because the company, Universal Health Services Incorporated, is a very anti-union company. They've proven to be anti-union on several occasions, most recently dealing with our members of 1199 SCIU who work at George Washington University Hospital here in the district, where they were found in violation of several, anti-labor practices, and were found in violation of labor law according to the National Labor Relations Board. And so when you've got an anti-labor organization, which, by the way, I'm not sure why the mayor is chosen to partner with, but when you've got an anti-labor organization, that will not continue to keep the workers who have kept this community together and been providing the quality care for this community for, again, some of them over 40 years, there's no continuity of care there, which again lowers the level of quality of care for patients that are being taken care of. So while we care about these workers and we care about them, continuing to be gainfully employed and having their job, we mostly just care about the fact of what this will do to the quality of care being provided by them or whoever is in the hospital to this community where our members also live.
And to be honest, most of our staff was over 60 on the OB unit, and quite a bit of them in labor and delivery, because we took care of ourselves and we could work. And they couldn't say that we couldn't provide whatever it needed, because when the rubber meets the road, we pulled together. So whatever it took to get these patients done, out to the unit, get the babies done so they can get to their moms, we did that. So that was the hurting part, was how they tried to demean us, tried to say that we were less than capable of doing what we needed to do.
The city has said that the part of the reason why they don't want to keep some of these employees to bring them into the new hospital when it comes is because of the poor view of this current hospital, United Medical Center, from the community, when in actuality it's not the workers that have been doing a poor job, it's the management that has been not providing the resources for these workers to do their job in the best, most effective way. And so they're pulling together what they can to make sure that the patient experience is the best it can be. And when you've got workers that are willing to do that and go through that to make sure that a patient's experience is the best it can be despite not having the resources, those are the workers you want to keep. So for the city and for this company to dictate to the city, Universal Health Services, to say we don't want those workers because those workers have a bad reputation, wrong. The workers don't have a bad reputation. This hospital does. And this hospital has a bad reputation because of the management companies that this city has put in place. So this talking point of the workers being part of the problem is completely off base. And it's really the workers that are going to continue to make this healthcare system here in DC the strongest it possibly could be. Not only will it not have high risk obstetrics unit, not only will it not have a level 1 trauma center, when based on the statistics here in the DC area, the part of the city that has the most trauma, the most violence, is on the southeast part of the city. So for there to be no level 1 trauma unit that's able to treat every type of trauma incident really doesn't make sense. And then when you talk about oncology for cancer patients, which was removed from United Medical Center about a year ago, these are all services that are needed in this hospital that potentially might not be there. So where will people go to get their health care? Are they going to have to go to a clinic? Is there going to be some type of service that they can get in their home? Are they going to have to travel across town again to other hospitals that will provide those types of services? Will the hospital take them if they have no insurance, if they're only on Medicare, if they're not even on Medicare, what is their outcome going to be when they're not sure if they can go to the hospital and get what they need because the hospital might not have the services or just flat out might not accept them because they don't have the proper type of insurance. And so these are all questions that, we as a union have been asking, that the community has been asking for months upon months that we have no answers to. And, all we've been getting from the mayor's office is that when we know what, this hospital deal is, all inclusive of, we'll start spreading that message to the community. But once the deal is done, it's too late to say we wanted this or why isn't this in it or how could you make this deal without these types of services. It's too late then. And so their strategy around the city's strategy around how they're going about creating this potential new hospital and who they've chosen as a partner and what that partnership will look like in terms of quality of care and access to care for this community really isn't on track or tracking well with what the community sees as its needs and what's critical for this community. 1199 SEIU has been partnering with community-based groups throughout the District of Columbia and a group that we've sort of been a part of creating called the DC Health Justice Coalition. And this, again, is a coalition of community-based groups, other organizations that are healthcare-based and otherwise that are advocating on behalf of the citizens of Southeast DC and on behalf of citizens of the District of Columbia to say that what this plan in the bits and pieces that we've seen is unacceptable and that the mayor and that the city have to do better. If they're talking about creating an equitable healthcare system for all residents, there is no equity in we'll have some of the services you need here, but you have to get everything else across town. That is not equity because none of the people in the other parts of DC have to go across town to get any of the services they need. So why does this community with the least resources, the least amount of resources, why should they be the ones to have to travel? Why should they be the ones to not have what they need right there in their community like everyone else in the district?
We do believe that access to care would be better for all if we had a process, the funding of healthcare set where those can easily access it. The idea that private insurance is the answer, we do believe that that has not been the case. We have too many of those who are not able to get, they might have health insurance, but the health insurance doesn't cover this, doesn't cover that, doesn't cover this. And by the time they need to get their care, many decide not to get the care because they're like, I can't afford it. Most small business, there's a long list of things that, isn't covered. And what we found with United Medical Center when it comes to the funding is that the funding is based on this artificial private insurance funding. It's based on this artificial review of the hospital outcomes or something. So, Care First is going to say, okay, we're going to pay if you get this procedure at Georgetown, we'll pay you $2,000. We'll pay $2,000. But if you get it at GW, we'll pay $1,700. But if you get it at Howard, we'll pay $1,000. And if you get it at UMC, we'll pay you $500 because of outcomes. So it is setting these hospitals. Now, if you notice, a lot of hospitals, when we met with Congresswoman Norton, she kept saying that hospitals are closing all over. Well, some of it is part of the strategy of the private industry and how they fund hospitals.
When we talk with people from, the mayor's administration, they tell us, well, people having to travel across town is just a part of healthcare. That happens in cities all across the country. And so when people have to travel, if they're being, put in an ambulance or they're being put in a helicopter to be, air trafficked across town or in an ambulance to be trafficked across town and something were to happen and the outcome doesn't, come out the way we want it to, well, then that's just a part of the process. And I say that you should be doing everything that you can to make sure that never happens, that shouldn't be where you start your process is by transporting people with critical wounds, with critical needs. That should not be the basis of how you build your equitable healthcare system. If it's equitable, it means it's the same for everybody. At least that's what equity means to me. And so they are off base. They are not in touch with what this community really needs if they're going to put all of the services somewhere else and not provide the same access to quality care for people east of the Anacostia River that they have for everyone else in the district.
Whatever that is given in Ward 1 through 4, it should be available set 5, 6, 7, and 8. it should be available. Should not be a question about why east of the river doesn't have what Ward 1 through 4 has.
So why doesn't it? Like, why is it not important for the politicians or the powers that be to ensure that folks in those wards have care?
I want to say this, that I think we should be clear that it's about race and it's about socioeconomic status. Let's just say the east of the river becomes gentrified. They'll put more business. They'll put more into making sure that there is some more healthcare in that area, and that is sad. Mm-hmm. So what we did is that when we went to the council, we brought residents east of the river with us. So then they can't say anything. You've got the people here, and we put them in the room. So now, when you want to say what's going on east of the river, tell it to the people tell it to the faces of the people that live in that community.
When you look at the disproportionate access to care for Blacker and browner and poorer communities versus the other communities in DC, this is a real crisis in healthcare, and it seems like the city is not recognizing the fact that there are longer lines in emergency rooms throughout the city. This isn't just a problem for people east of the river. This isn't just a problem for the poorer communities, because when people need healthcare, they have to go where healthcare is available. And so in the other four hospitals that are in the district, they're seeing the overrunning of their emergency rooms and the longer wait times for people to get emergency care that they need. And that's a problem for all of the residents, not just residents east of the river or poorer communities. That's a problem for everyone.
Everything sounds devastating. And for us, there needs to be a hospital. There needs to be United Medical Center fully funded. Whatever new hospital comes, there needs to be fully funded. Whatever gaps that need to be filled, the Department of Health and whatever the resources that the mayor has needs to fill it in.
I just plead with them. Stop treating the people that live in 7-8 like they don't matter, because we do.
For more information on these organizations and the work that they do, check out their websites at the links below. And that will do it for this week's Dose of Dissent. Thanks so much for watching. Be sure to sign up for our newsletter, and if you can, donate to keep our work going beyond the weekly show. And there's more information about that upcoming shift available at patreon.com/actout. From the Devil's Den, good night and act out. And real quick, to keep independent, non-corporatized media like this show going, visit patreon.com/actout.
I can hear the boots are stomping. Come on, boys, let's get some rice to throw. I can't stand to hear my father cry anymore. Time we left one of you motherfuckers dead in the road. We've been begging up inch by inch, we got nowhere else to go. It's been too many years since you pushed and said my shove. I'm not a violent man, but